Welcome and good evening to another edition of the I Am Abel Foundation's Medicine Makers, where if your destination is a career in medicine, we're going to show you how to get there. I am your host for the evening, Dr. Renee Roberts. I'm a board-certified family medicine physician, as well as a physician mentor with the I Am Abel Foundation. We are super excited to be back on the air for the 2023 season of Medicine Makers. We have a fantastic show planned for you tonight. We have a dynamic guest, Dr. Erica Taylor, who is a women's health expert, leader in women's health, as well as a board-certified obstetrician gynecologist. She has a fantastic discussion planned for us today. So welcome to the show, Dr. Taylor.
Thank you so much for having me, Dr. Roberts.
Yes, so we will be starting with Dr. Taylor in just a second. Of course, we just want to give a couple of announcements. You are watching us here on CAN TV here in Chicago. You can also stream us live at www.cantv.org on Channel 21. And just a little bit about the I Am Abel Foundation. We are a Chicago area nonprofit organization that is geared towards increasing underrepresented minorities in medicine. We provide mentorship, such as ourselves, serving as physician mentors to high school students, college students, as well as post-baccalaureate students. So for those of you that have already graduated from college but are thinking about pursuing a career in medicine, we would love to have you check us out. So if you are interested in learning more about the I Am Abel Foundation, check out our website, www.iamable.org, and Abel is spelled A-B-E-L. Okay, well, like I said, it's good to be back on the air. COVID tried to shut us down, but we're back now, and we have a fantastic guest for you again, none only than Dr. Erica Taylor. My goodness. Let's see. She is board certified in obstetrics and gynecology. She is currently working at Southern Illinois University School of Medicine in Springfield. Prior to being at SIU, she was medical director at the Chicago Department of Public Health as an obstetrician and gynecologist, also an associate program director at Mercy Hospital. She's extremely passionate about advocacy, social justice, improving healthcare for marginalized communities as well. I could go on, but we only have so much time on our show. So welcome, Dr. Taylor.
Thank you so much. It's a pleasure to be back again.
Thank you. So, we always like to spend just a little bit of time. I know we're obviously both physicians. We each had different journeys. We actually went to the same medical school. But why don't you tell our audience a little bit about your path to becoming a physician?
Absolutely. So the road to becoming a physician was very circuitous for me, I would say. I started out after undergrad. I ended up working in social services for a number of years before pursuing medicine, but my undergrad degree was in pre-med bio. My scores on the MCAT were not as stellar as they probably should have been, so I did end up taking it a couple times before I was able to gain admission into med school. I ended up doing a post-baccalaureate program at Indiana University. It was called the Masters in Medical Sciences program, the MS program. And really, it gave me a great foundation in regards to preparation for med school. And then I matriculated into the Indiana University School of Medicine. And so have always been very involved in local programs. I'm a product of CHAMPS, which is the Chicago Area Health and Medical Careers Program, which is a program that was based out of IIT. I started with them probably like third or fourth grade.
Wow.
In regards to just getting acclimated to science and doing some of the local science fairs and things like that. And then as I progressed into college, I ended up reconnecting with them. I had actually moved out of state, ended up moving back here for undergrad and reconnected with them after college and did some MCAT prep with them. And really, when we talk about pathway programs, that is truly that was one of the forefronts in regards to pathway programs here in the city of Chicago. And so I ended up reconnecting with them for like MCAT prep. When I ended up gaining interest into med school, they were like, hey, we're going to pay for your boards. And so really, it's been just a full circle.
Wow, that is fantastic. And what I love about your story, we have a lot of similarities. The path to becoming a physician can be very challenging, but that does not mean that it is not possible. And it's always good to be able to see physicians such as ourselves who have gone through that process. Myself, having done a master's program as well prior to medical school, all very beneficial things. So there's multiple ways of getting to that finish line of being a physician, but it's always nice to know that mentorship is important, support systems are important, and that's what the I Am Abel Foundation is all about. So thank you so much for sharing your story. Definitely want to get into the topic tonight. Dr. Erica Taylor is an amazing obstetrician, gynecologist, women's health expert. So we wanted to spend a little bit of time this evening focusing on women's health. And it's been a challenging past couple of years just dealing with the COVID pandemic, the stress that comes with that, the social justice movements. And so I thought it might be good. I have some questions about maybe talking about stress and how that impacts our health and how that impacts our body.
Absolutely. So one thing that I like to think about in regards to stress and the impact that it has on our body is something called the cortisol effect. And so when we think about us as African Americans and our ancestors who underwent slavery, there's some thought that there's still some residual effects from slavery where we have this chronic stress syndrome that basically leads to higher rates of chronic disease such as diabetes, high blood pressure, high cholesterol. And so one of the things that we have really seen in regards to the pandemic is that they talk about there being two pandemics, the COVID-19 pandemic and the 1619 pandemic. And so that whole pandemic in regards to slavery and how we're still dealing with those stressors in health, in regards to mental health, and then also the fact that so many people had become secluded during the pandemic that we started to see a lot more mental health issues as well. And so the other issue is that many people were then also neglecting like their primary and preventive care services, things such as pap smears, mammograms, routine testing, and things of that nature. And so we did see an uprise in some of those chronic diseases as well.
That's an amazing point. Like you said, I love that about the twin pandemics. I think we all know in many areas, particularly here in Chicago, a lot of urban areas, that the African American community got hit extra hard during the pandemic and probably brought to light a lot of disparities, lack of access to care, quality care for that matter. But yes, we're already in many regards have higher rates of the hypertension, so high blood pressure, high blood sugar, which is the diabetes. What types of things with regards to that did you see with any of your patients during the pandemic, or what were they expressing to you?
So I think a lot of the issues that we were seeing is that patients, especially with pregnant patients, the issues of, now we have telemedicine. And telemedicine is great for certain patient populations. However, pregnant moms actually need to come in to be seen. They need to be seen.
They have certain things that need to be done to check on the baby. Absolutely.
So one of the things that we really saw was a higher rate, and we're still seeing a higher rate of fetal deaths. And so moms who were maybe not seeking regular care. So we saw that issue. And I think it goes back to that cortisol effect. Maybe there was some impact on the placentas as well that we still don't quite know. But I can name several people personally who actually experienced what we call intrauterine fetal demise or neonatal deaths secondary, and there being no reason as to why, and they had no other issues. And so really I felt like this pandemic really led to that increase in the impact on the maternity.
Wow. Well, that is knowledge. As you always like to say, knowledge is power. And you keep mentioning that magic word, cortisol. Okay, so for those of us who may not be aware of what cortisol is a hormone that our bodies secrete during stress, which helps us to actually gain weight, add on more fat tissue, which is great if we're in times of, being stuck on a desert island somewhere, but most of us are not. And so, know, I see that in my patients as well. Under times of stress, the next thing I hear is, Dr. Roberts, I'm putting on weight, I'm gaining weight. And so that is a very interesting point that you brought up. What are some other areas that women might be neglecting with regards to their health?
One of the other issues that we've seen in regards to women is just the lack of having routine screening. So in regards to mammograms, so the recommendation is to start mammograms at age 40 and to have them done annually. So what we saw with the pandemic is that many patients were afraid to seek out care. And so it's so important that you continue to do that. We started to see a higher rate of breast cancers. Also in regards to pap smears, January is actually Cervical Health Month. And so just the importance of also having routine screening in regards to getting a pap smear. The pap smear is a test that looks for precancerous cells or also HPV, which is the human papillomavirus, the virus that's thought to lead, that's actually known now to lead to cervical cancer.
Wow. Okay.
And so women should start getting screened at 21.
Age 21.
Correct.
Okay, you heard it here first. Age 21 to actually start screening for pap smears. How do you have that conversation with ladies? Because I know I've had that as a family medicine physician. I perform pap smears as well, and you know they're hesitant. Or I get some that say, "Well, I may not be sexually active just yet, so I don't need a pap smear." How do you encourage, the preventative health measures?
Absolutely. So one of the things that I think is important is that we start to have those conversations before 21. And so I start talking to kids as young as 10 to 12 years old, along with their parents, in regards to these are some of the steps that we will go through as you progress or as you age. And so starting to talk about the pap smear, I take out the speculum, I show them what it looks like, I let them play with it. Also, I think it's important that, we start to talk about the anatomy too. So look, this is what the uterus looks like, these are the ovaries, and so I have these models in the office, and so we can really just demonstrate this is how we would perform the pap smear. And then when we talk about prevention, in regards to cervical cancer can actually be deadly. And so we talk about the importance of doing the pap smear because that can help to prevent a potential death down the road. I can count multiple patients that I've seen that have come in and saying, "Oh, I haven't had a pap smear since I had my baby." And I was like, "Oh, well, how old is the baby?" The baby's now 47.
47.
And so again, just the importance of having that routine screening. So if you're age 21 to 29, you should be screened every 3 years. If you were 30 to 65, it's every 3 to 5 years. But we still want to see you once a year. We don't want you to run off.
Absolutely.
Just because we're spacing it out, that doesn't mean run away.
Absolutely. Now, what about mammograms? The patient population that I'm working with right now are actually older adults, but older adults still need to get mammogram screenings, and I cannot stress this enough. I hear it all the time. "Oh, but Dr. Roberts, it hurts. It's so uncomfortable. I don't want anybody, squeezing, pressing down on my breast. It's too painful. I'd rather just not go." How do you have that conversation with your patients?
So I usually encourage them just in regards to letting them know that the pain that they can experience with a mammogram is very finite. And so it's less than 2 minutes, I would say. And so really, especially people that have had childbirth, I would say the pain is not as bad as childbirth, or if you've ever had an appendicitis or a gallbladder attack.
Kidney
stones. Absolutely. So it's a urinary tract infection is actually, I feel, is less painful. It can be more painful than a mammogram. And so really trying to encourage them that they can also take something for pain beforehand.
Okay.
But really, it's a very quick process.
Yes.
It's so necessary.
It is necessary, and I think one of the, what's an important conversation to have, it's good to have that, open, honest communication between patient and physician, because I think this contributes to a lot of health disparities, okay, particularly in Black and brown communities. Sometimes it's mistrust of, physicians, but it's also times like this where we need to have these conversations to say, hey, it's really important for you to go out and get your mammogram, get your pap smear, because not knowing can actually do you more harm. A lot of these conditions, like you said, the cervical cancer, breast cancer, if caught early enough, are actually
Can be treated.
Absolutely. Fantastic. Well, why don't we switch to another topic that I know a lot of women like to talk about as well, too, the dreaded thyroid. The dreaded thyroid gland. Particularly this time of year, everyone's trying to work on their fitness and get back in shape. And I hear it all the time, too. My thyroid has stopped working, and that's why I'm gaining weight. So what are your thoughts on that?
So, in regards to the thyroid, I think of the thyroid as like the thermostat of the body. And so really it regulates so many things. It can regulate your weight, whether it be up or down. It determines like if you're cold or hot, or if you're more constipated. It can also, like if it's not working well, you can have issues like depression. And so I think it's important that you have a baseline in regards to getting some blood tests done to determine if you do essentially have a thyroid issue. Your physician can also do an exam where they can actually feel for the thyroid to see if there's enlargement there. So I do think that's important that you do have that conversation, with your physician. Sometimes, the weight gain can be just due to other issues as well. I think sometimes that, especially with the pandemic, I think people have become more sedentary, where we're not out, we're not about, we may not feel as comfortable going back into the gyms and things like that. Or you may live in a neighborhood where it's maybe not the safest place to walk or go out for exercise. And just with everything that's going on in our communities, just people I think have just turned more inward instead of seeking out external environments to work out in.
You brought up a very good point about that, because I am seeing that as well, which is kind of sad. We're battling the weather, okay, for those of us that are living here in Chicago. It's snowing today, dealing with that. Or two, like you said, maybe it getting dark really early out, not feeling comfortable to go out. I know that you are definitely into physical fitness as well, and keeping your body healthy. Do you have any advice, particularly for those folks that would like to be able to get out, exercise? Are there things that they can do at home, or something that can help increase their physical activity throughout the day?
Absolutely. So I would recommend, first of all, I think getting an accountability partner. I think that's really key when you have someone that's waiting for you at the gym, or someone who's going to wait to walk with you. That's also safety in numbers. And so really, I think finding an accountability partner. There are so many things I feel that you can do at home. Let's say if you don't have like money for like expensive weights and things like that, you can buy 2 gallons of water, whether you're like $1 a piece.
Those are heavy.
And those are some pretty good weights.
To do your weights, yep.
Or some canned goods. So
Okay.
I think we just have to get really creative. I mean, you can do jumping jacks when commercials come on, or
That's a good one.
some push-ups. If you can't do a full body push-up, you can do push-ups off the wall. So there's just a lot of different things that you can do. There is a plethora of like videos out on Instagram, on YouTube, and things like that as well, or even just searching your web. So definitely, I think there's that possibility. And then there's also a lot of gyms that are now offering like virtual options. One of the things that I actually did, I purchased a Peloton during the pandemic.
Okay.
And I was very, very faithful in regards to riding it. But it's like I love the energy of being in the gym. And so once gyms started opening up again, I kind of acclimated back. But now I'm using the bike a little bit more too, because I just feel like it's something I invested in, and I don't want it to be a clothes hanger.
Or collecting dust, yes, the most expensive clothes hanger out there. Okay, well, everyone, you are watching the I Am Abel Foundation's Medicine Makers here on Chicago's CAN TV. If you are watching now, you are probably streaming us at www.cantv.org on Channel 21. We are having a wonderful discussion this evening with women's health expert, board-certified obstetrician gynecologist Dr. Erica Taylor. So thank you again for being here. We'll go ahead and keep going with the conversation. One thing that I know that you might deal with a lot with women's health are menstrual periods, menstrual cycles, not having one, having too many, bleeding too much. What are your thoughts on that?
Absolutely. So that's actually one of the most common things I think that women will see me for, is just issues with bleeding, or as we call it, abnormal uterine bleeding. And so in regards to that, first of all, one of the first things that we usually will do is run a pregnancy test, because that can be one of the signs of like the lack of a period or just irregular bleeding. So starting there. So don't get offended if they're like, oh, well, let's do a pregnancy test. Now, if you're not sexually active, then that's a different animal. But in regards to that, as we talked about the thyroid earlier, the thyroid also has an impact on our menstrual cycle. And so again, that would be one of the tests that can be done to determine if that's one of the causes for irregular periods. And then there are also other issues, like more structural issues, where patients patients could have something called fibroids, where there are these non-cancerous growths that can develop in the uterus. They're very common in Black women, and so if we were to put if we were to put 10 Black women in a room, 7 to 8 of them would have fibroids. And so in regards to that, in regards to the cause of fibroids, the verdict is still out, but there's some thought that, maybe it was due to relaxers. But the thing is, now there are so many different people who are now natural. So, like, what is it? So is it something that's genetic? Is it environmental? Is it something in the food that we're eating? But really, we'll have patients that will come in with these very, very heavy periods. And so there have been a lot of new modalities put into place in regards to treatment where, let's say 20, 30 years ago, most women would end up with a hysterectomy, but now there are lots of other things that can be done in regards to treating fibroids. So things such as medications, there are surgeries that are more or that are more conservative, where you can just go in and remove the fibroid, something called a myomectomy. But lots of different things that can be done now.
Okay, excellent, excellent. Well, another topic of discussion that I'm pretty sure that you are probably asked about quite a bit. We have a lot of younger women or Generation X out there who have not had children yet, and maybe there are conversations you heard about, should I get my eggs frozen? And so for those of us that are out there in our audience who don't know a lot about freezing our eggs, what advice would you have?
Absolutely. So I'll just first talk a little bit more about what the definition of infertility is. And so in regards to infertility is basically if you've been attempting to get pregnant for 1 full year and have not been able to get pregnant. And typically we would start to have patients get worked up if they're 35 or older and have not been able to get pregnant. If someone is age 40, then we would say after 6 months of trying. And so the possibility of getting pregnant goes down with age. So we as women are born with all the eggs that we're going to have. And so if you're 32, your eggs are 32. If you're 49, your eggs are 49. So, again, as we age, there's also the increased risk of genetic disorders as well. So things like trisomy 21, Down syndrome. And so in regards to, egg freezing, we're starting to see more people are definitely delaying childbirth due to career or just personal issues where it's just that may not just be something that they're interested in, or maybe they haven't met the right person. And so I think that if you are a woman of a certain age, if you're 32 to 35, it may be something that you may start to consider. Let's say if you have not, there's not a partner potentially, and you do know that you want to have children, the conversation can be had by going to have a consultation with someone called a physician that's called a reproductive endocrinologist and infertility specialist, so REI. So in regards to obstetrics and gynecology, we have our general OBGYNs, which I am, and then you can do an additional 3 years of training to be a specialist in infertility. And so many places will actually offer the first consultation free. And so if that's something that you're interested in, you can seek out some of the various infertility clinics. There's various ones here within the Chicago area as well. And then most of our university hospitals also have REI departments as well.
Excellent information. Excellent information. Thank you so much for that. Is there anything else that you would like to share with our audience this evening?
I would just say in regards to 2023, in regards to activity, I would say one other thing is if you're working within an office setting, to just get up and just walk around, or if you have access to maybe work from a standing desk to
as opposed to sitting.
Absolutely.
They said sitting is the new smoking.
And that's horrible. So definitely just starting to just be more active if you can take the stairs. So just small things, just adding a few extra steps into your day, I think can definitely help to improve overall health. And I think that especially as we age, I think it's so important that we continue to stay active. I know they've been talking a lot about women, as we approach 40 and over, the importance of adding weightlifting into your workout regimen. And I think a lot of times women are very nervous about...
We shy away from that, don't we?
Absolutely.
Yeah, because I know I've done that at the gym. I'm like, I don't know if I should lift weights, and they're like, put the weights in your hands.
Exactly.
So what are some of the benefits of weightlifting?
Absolutely. So when we talk about bone loss, and so women that lift weights, it's like your bone mineral density or your bone density is going to be higher. And so typically, as African American women, we typically have a higher bone mineral density, but however, that can be diminished if we're not being physically active. And so also in regards to like osteoporosis. Definitely like Asian women and thin women, Caucasian women are more likely to have osteoporosis, but it can happen in Black women as well. So that can also help to thwart off things such as osteoporosis as well.
Okay.
And I think also just mental health. I think that it's also important. I feel like when you work out, you release these natural endorphins. So these hormones, the happy hormones as we call them.
To make you feel good.
Absolutely.
Yeah, absolutely. Wow. Well, that was an absolutely fantastic discussion. We're going to have you back on the show,
Absolutely.
Dr.
I would
Taylor,
love that.
because you were just a wealth of knowledge. I learned a lot from you. I hope that you out there did as well. How can people find you if they're on social media?
Absolutely.
How can they find you?
So you can find me on Facebook at Dr. Erica 2.0, as well as Instagram at Dr. Erica 2.0, and on Facebook as Erica E. Taylor.
Awesome. Well, thank you so much again, Dr. Taylor, for your expertise this evening. Again, you have been watching the I Am Abel Foundation's Medicine Makers, and we will be back next Thursday, 6:30 p.m. Central, here on Chicago's CAN TV. See you then. Have a good night.